The Botox business is booming. Actually, all plastic surgery is right now. According to the American Society of Plastic Surgeons, cosmetic plastic surgery procedures rose 5% in the last year. So if you're thinking about getting some work done, we have the questions you need to ask your doctor. Joining us right now is board-certified plastic surgeon Dr. Elie Levine. Good morning to you, doctor.
Good morning.
Why is winter the most frequent time to go in and see the plastic surgeon?
So as we head further into winter, people start realizing that they're going to have to be wearing a little more revealing clothing, maybe a bathing suit in a few months, and they begin to appreciate that, you know, showing off their body is going to be a little more important. So
time to think about the lipo.
Exactly.
All right. Now we got three questions that, if you're thinking about it, these are things you need to ask your doctor. First of all, are they board certified? I figured everybody was board certified.
So that's a really important point. Finding out whether your surgeon or practitioner is board certified is important, but equally as important is finding out what field they're board certified in. Because if they're board certified in plastic surgery for a surgical procedure, or whether it's Botox and fillers, if they're a board certified dermatologist or plastic surgeon, that's really important. If they're board certified in radiology, internal medicine, one of the fields where the core principles and core teachings don't involve cosmetics,
sure,
you might be setting yourself up.
I have read somewhere that, you know, because Botox is so popular these days, some doctors are able just to go in and take like a little weekend course to learn how to do it. They might be a doctor in a completely different field, but they can make money shooting people up with Botox.
And that works. And in many instances, people have great success with it, patients that is. But the problem is, do they have the ability to solve problems if they get into trouble, if someone has different type of anatomy? And that's where all the training comes in, where it's not just a matter of being able to do the procedure, but can you take care of anything that might happen with the procedure?
And that's why this next question is so important. How much experience do they have?
So this is a tough one to answer, because if you go online, and it doesn't matter where you live, people's websites show that they do anything and everything. And really, one of the clues, and this is kind of a hint that I thought of, was that there are 4 subspecialties in plastic surgery. There are people that can do extra training in cosmetic work, in pediatric plastic surgery, microsurgery, hand surgery. So if you find out if they have extensive experience in cosmetic work, well, then you're in great shape. But if you find out that they also have hand training, they may be great, but then again, if you're sitting in the reception area and you see 8 people in casts, maybe they do more hand surgery.
A good point. And finally, what's it going to cost me and why?
So costs vary by region. The real thing you have to look at when assessing these things is shop around a little bit, see what different people are charging.
Call on the phone?
No, well, I mean, go visit with plastic surgeons, because there are 2 factors you're going to get from visiting. One is you're going to get a sense of really whether they are listening to you and they're in tune to you. And the other is you're going to get a sense of cost differences.
Okay.
You know, this is a serious, important, and exciting decision, so you really want to have a comfort level with your practitioner.
And for folks at home who are wondering how much does this stuff cost, we've got the average prices of popular surgeries. Botox, $250 to $500 per area. Lip injection, $500 to $1,000. Breast enhancement or reduction, about $10,000. And if you need to have your nose job done, 6 to $10,000. Tummy tuck. There it all is. So you've said drop by, talk to some different doctors, get some prices, but ultimately you got to go with the guy who you feel is going to do the best job.
Exactly.
All right. Doctor, a real pleasure. Thanks for making a house call today.
My pleasure.
Studio call, let's make that. All right.